Okay, hello everybody and welcome to this webinar, Disabled, Refugees and Liberty. We're holding this webinar today mostly because it's the European Independent Living Day, a day which we celebrate our movement of independent living, and we're happy to be able to have this webinar and with so many of you that are joining us today. We will, I will be presenting the different speakers, but first we'll have Anne-Marie who talks to you about how the webinar is going to work.
Yeah, thank you. A warm welcome from my side as well. I would like to give you a little instruction on how this webinar works in technical terms. Everyone will be on mute unless you want to say something. Please remember that you have to unmute you then. If you as a participant have a question, you can either type your name or your question directly into the chat box or raise your hand. That's a function you can access when you press on participants. There you can raise your hand. And then you'll be called later when it fits. Furthermore, we'd like to point out that this webinar will be recorded. So you'll get the video someday after the webinar with the displayed background slides as well. Thus, you'll be able to reread certain informations and click on links and resources. Furthermore, we provide a closed caption today. You can access them by pressing on the closed caption button at the bottom, the CC. And there you find an upwards facing arrow. And if you click on that, you can change the subtitle settings and put it on max so that the closed captions are appearing big. Afterwards, you can close the settings and you'll find subtitles, the whole webinar. If you have problems or anything, you're welcome to text to the hosts or write an email to Ines Bullig. She'll maybe can help you. Yeah. Then we are back to the agenda and I hand back the word to Jamie. Thank you.
Okay, thank you very much, Anne-Marie. One thing also I saw at the bottom there that it said that the PowerPoint presentations will be sent out afterwards. So myself, I'm Jamie Bowling, the project leader of Disabled Refugees Welcome and the director of the Independent Living Institute. It's in cooperation with ENIL and the European Network and Independent Living with Ines that we actually hold this event. I will be speaking about the project Disabled Refugees Welcome. And after that, we'll have Ricardo Cordero, the protection officer from Disability Inclusion for UNHCR. After Ricardo, we will have, next slide, please. Gianpero Grifo from Disabled Peoples International World Council member, who will speak on the work that they're doing and different perspectives as well. And then Anne-Sophie Lienknecht from Human Rights, who is the Human Rights Coordinator with the EDF, European Disability Forum. Next slide. And then I'll talk one more time about the results of our project. Then we'll open for questions and discussion for everybody, which you'll send through the chat to Ines. Okay, next slide. So what is Disabled Refugees Welcome and how has it worked? And what impact have we seen with COVID-19? Next slide, please. So DRW is a project within ENIL. ENIL is the Independent Living Institute in Stockholm, which was founded by Otto Fratzke in 1993. It's a foundation, not a membership organization, which is financed through doing different projects which promote independent living. So then what is independent living? For us who are members of the movement, it's a philosophy and ideology. It's a way of being able to move society forward including disabled people, so that we can live in the society on an equal basis as everybody else. We have 4 pillars: choice, control, participation, inclusion. I should be able, we now have also the Article 19 in the UN Convention, which gives us a good instrument of support on independent living. But even way before, for 30 years ago, we talked about having to have the choice on where we want to live, how we want to live our lives, not being put into an institution and having everything decided for one. To be able to have control over the services that we do get so that we can live a life of full participation and with inclusion. Next slide. During the presentation of DRD, I'll talk about what is DRD, who is the team, how does DRD work, and the DRD products. Next slide. So DRD, Disabled Refugees Welcome, DRW, is a project of the Swedish Inheritance Fund. If I were to die tomorrow and had no children, the money I have would go to this inheritance fund. And then people, disabled people organizations, as well as youth organizations, can apply for funding from this fund. And that's what we've done for this project, which is a 3-year project, started in 2017 and ends in 2020 in December. The aim of the project is mapping of needs in relation to reception, establishment, and integration, needs of disabled refugees and disabled migrants, to see what are their needs and how is the integration process coming along. Next slide. The start of the project, as you see here, a picture of Julius to the left, and then Ola Fratska, who founded Independent Living Institute, Disabled Refugee Welcome, as well as actually ENIL. Julius came to Sweden in 2015 as an immigrant, or as a disabled refugee. And when he got here, he thought, okay, finally I'm in a country which will be perfect, everything will work for me as a refugee. But instead he was met by inaccessibility and poor attitudes, and found that he had to fight for different things. For example, for getting a bed that he could get into, because he was assigned a bunk bed. Having had polio, he couldn't climb to this bunk bed. And then the response was, get a medical certificate. So it was a way of being treated that he just wasn't expecting. So he talked with Adolf, who he had known through the disability movement already from his country. And they spoke about these problems and thought that a project to counteract this could be interesting. And that's where the idea Disabled Refugees Welcome came from. Next slide. The team you have here with Julius on the left, Rahel Ababafna, I can never say that name, in the middle. Rahel comes from Ethiopia, not as a refugee. She married a Finnish man and is living in Sweden then. And then you have on the right, Sus Romero, who is from Ecuador, myself in the wheelchair. And we all share an experience of migration and a disability. And we found that this would be important for this project to get the trust from the people that we were going to meet. You see, I'm the project leader, Julius is a field worker, Rahel is our counselor, and Sue's work with method development and communication. Next slide. So how does it work? Julius does our field work. Julie goes out with brochures and materials in the beginning to the city squares, to the libraries, to people he would meet on the street, handing out information. Then we started targeting very important events on refugees in general, to be able to talk to people there and to raise the issue that some of the refugees could be disabled people, which was, oh, they hadn't thought of that. Then when people find out about us, they call. That's when the counseling starts with Rahel, who will talk with them, eventually do an interview if they're willing, and find out what are their needs, what's working, what hasn't worked, and what kind of solutions can we find for the integration process of these people. We work with empowerment. We believe that it's important that the individuals themselves or the family of the individuals become strong, understand the system, and can then later apply and ask for the support that they need. Another thing that DRW works with is political lobby, raising the awareness of the group and the needs of this group. Next slide. We will have products. One is an information handbook where we have both in Swedish and English. The slides will, the link will be in the slides when you get them. We're working on a method handbook, which should be done within a month. In the handbook, you'll find lists of recommendations. And the last project will be something called Good to Know, which will be tips that we can spread further after the project to disabled migrants. Next slide. Here's just the book in English called Integration for All, and the link, which is quite long, so you won't remember that. It will also be easy to read. Next slide. So DRW and COVID-19. We realized talking to the group and meeting with the people that we work with that they weren't accessing the information that's being sent out to the public through the television, the radio, the newspapers. They weren't accessing the important information on health safety, understanding that you have to wash your hands for 30 seconds in order to kill this virus. They weren't accessing the new rules, the changes that were happening in the country, or the encouragement, for example, to stay at home if possible, to not go out into society, not ride the transport system. They weren't understanding why their operations were being canceled. They called to Rahel and said, I was supposed to have an operation on my foot, it's canceled, I don't understand why. She had to explain it's because it's not prioritized in this time of a crisis. They weren't understanding, for example, that the Swedish courses had been canceled. That they understood, but they didn't realize they had to go home and still continue working, still do the work and the reporting, otherwise they fall out of the system. Next slide. Thank you very much. That's the first time, but I'll be back soon. Now we'll go over to Ricardo. Please, Ricardo, for the UNHCR. The floor is yours.
Thank you. Thank you, Jamie. And well, I would like to say hi, everybody. And in particular, thank Disabled Refugees Welcome and the Independent Living Institute and the European Network on Independent Living for inviting me to this webinar. I am a protection officer working in particular in disability inclusion for the UN Refugee Agency. I am based in Geneva, not currently because of the lockdown, but I am supposed to be based in Geneva. And I'm part of the community-based protection units, which is within the Division of International Protection. Next slide, please. Today, I would like to talk about the policy or, framework that UNHCR, that guides UNHCR's work as regards to liberty and refugees with disabilities, and then share some of the practices. I have selected some articles of the Convention on the Rights of Persons with Disabilities to try to establish a map and to follow the trend and the evolution that UNHCR has been following, thanks or guided by the principles and the contents of the CRPD. Just as a small reminder, I will be not speaking only about the right to live independently and be included in the community, Article 19, but as well about Article 14, which is liberty and security of the person, and in particular, highlighting how refugees with disabilities should not be deprived of the liberty unlawfully or arbitrarily. Then liberty of movement and nationality, which is as well related to independent living because it allows persons with disabilities who are in forced displacement to access documentation and as well documentation of identification, including as part of immigration processes. And as well because it refers to children with disabilities who should be registered as well in situations of displacement. Then in terms of independent living, in situations of refugee, migration and forced displacement, the right to choose the place where persons with disabilities would like to live, accessing community support services, but as well community services and facilities that are for the general population as well should be a right to be respected. And it is important to note as well that the Committee on the Rights of Persons with Disabilities explicitly has highlighted that these rights apply to refugees with disabilities in one of the general comments that is available online. And finally, as well, few notes around personal mobility, which links with access to mobility aids, devices, assistive technologies, and training on mobility skills that in displacement settings should be as well crucial to secure independent living. I will try to highlight all this content, which is really, really massive in terms of examples, but just highlighting some of these areas through processes such as identification and registration, community-based protection, human rights mechanisms, and participation. Next slide, please. So in this slide, we see 4 key areas of policy that guide UNHCR's work. And we see one of them represented in the cover of a picture, or the picture of a cover of one of those policy documents, that is UNHCR policy on age, gender, and diversity. So how are all those rights that I mentioned before reflected in the UNHCR policies framework? Well, probably the first document that should be referred would be the Executive Committee conclusion, number 110. This represents a paradigm shift in previous approaches to disability, both in the world, but as well within the agency. And of course, it's a paradigm shift that is in line and facilitated by the CRPD. Within the conclusion, we can see that the primary responsibility of states is reaffirmed, but as well, it is mentioned that when host countries are having limited resources and face challenges in providing services and facilities for refugees with disabilities, UNHCR role would be to assist states in fulfilling these responsibilities. And in particular, different areas that I've mentioned before are highlighted. For example, recommending that there should be a swift and systematic identification and registration of refugees with disabilities, as well having refugee status determination and all relevant processes accessible. Then improving the living conditions of refugees and other persons with disabilities, and providing equality of opportunity for durable solutions for persons with disabilities. That means that resettlement processes should be as well made fully accessible and non-discrimination or not avoiding discrimination on the basis of disability. This overarching policy commitment has been then made practical into further implementation through including the assistance and protection of persons with disabilities in other policy frameworks, some as the age, gender, and diversity policy, which is a policy that is more referred to and directly used in the field as a direct source for not only disability, but other factors of risk of discrimination. And this policy includes as well mentions to disaggregating data by sex, age, and disability, or having participatory processes accessible for persons with disabilities, and identifying and removing barriers. A more, let's say, practical commitment and engaging not only UNHCR, but states and other stakeholders responsible for the protection and assistance of refugees and other displaced persons was as well made in the Global Compact on Refugees. Here we see again that disaggregation of data is part of the commitments shared, and as well the establishment of reception and transit areas that are sensitive to age, gender, and disability. Finally, I wanted to mention the UN Disability Inclusion Strategy, which was launched last year. And while not including any indicator or mention to independent living, it includes indicators for accessibility and reasonable accommodation, among others. And at least for UNHCR, but I am sure for other UN agencies, has served as well as a very comprehensive mapping exercise to see where we are at now. and then from there draw recommendations to really implement the implementation of this policy framework that as we see is very well aligned with the convention. Now, in terms of practices, and I would like to go to next slide, please. Some of the practices that I wanted to share, and we see a picture of the vulnerability assessment framework that is an exercise conducted in Jordan. Well, first, to ensure that persons with disabilities have equal access to humanitarian protection and assistance, including refugee status determination or resettlement, and to participate in humanitarian programming at large, the first need is to be visible to states and humanitarian actors. However, current systems of data collection and analysis often under-identify persons with disabilities and do not allow for comparison of data. This hinders effective needs assessment, monitoring, disability inclusion, but overall as well the response towards this population. What UNHCR has been doing in the last years is integrating the Washington Group questions within the registration processes and other data collection efforts. For those who are not familiar with the Washington Group, these are a set of questions that are designed to identify persons with disabilities in a non-stigmatizing way. The challenges, of course, are still there because those are several questions, at least 6 questions, and some of the registration or data collection efforts happen in few minutes when refugees are crossing borders or other points. But good examples show that when they are used, the percentage or the prevalence of disability among refugees is going to be higher. For example, in Jordan, in the assessment framework that is shared in the screen, it was reported that 21% of Syrian refugees living with a disability were in the country, and almost half of the households, that means 45% of households, had a person with a disability living in them. Regarding the rest of processes for identification, registration, refugee status determination, etc., UNHCR is as well integrating knowledge and capacity for field staff to ensure the provision of accessibility and reasonable accommodation. This is done through review of manuals, developing of trainings, and as well in collaboration with organizations with persons with disabilities. This is going to be in the future, but it's something that I wanted to mention as well. Next slide, please. Then a next step forward would be, well, response. When, as I mentioned before, both from a technical perspective, but sometimes as well as a direct service provider, UNHCR can provide certain services related to independent living. And this would be following a community-based protection approach, which is an approach that empowers communities to obtain the rights safely and with dignity. Some of the activities that could take place would be sharing information but as well receiving information from refugees as following a communication with communities approach, as well as facilitating community support and access to services through volunteers, partnering with organizations of persons with disabilities in country or with other organizations representing refugees, providing access to cash and voucher assistance, as well referral mechanisms for particular protection issues and even providing legal advice there. And it could as well include providing accommodation for refugees and asylum seekers with disabilities both in camps or in urban and rural areas. And finally, assistive technology. Just to mention some of the challenges that are found in some of the context, and highlighting the picture that you can see in the screen is a report on bridging the mobile disability gap in refugee settings with a picture of a girl with a phone. Well, having access to information, in particular, for example, in these days with the COVID response is particularly important, very relevant, and sometimes even life-saving or life-threatening, not having access. what happens is not everybody in refugee settings have access to to internet and a phone. And this research, for example, that is only from last year, highlighted how this gap is stronger in persons with disabilities living in displacement. The hope is that sharing this data, there will be response from states, from operators, UNHCR as well, and other humanitarian actors to bridge this gap. And just going to the next slide, what UNHCR does in addition as well is engaging with human rights mechanisms when those situations of rights violations are identified. For example, in the slide, we can see a picture of the hard condition that refugees are facing while waiting to cross a border, and representing a woman with a disability among these persons, at least identifiable as a person with a disability. The way UNHCR engage in human rights mechanisms can include engaging in regional and national human rights institutions, such as the Human Rights Council, the CRPD Committee, and highlighting through reports and contributions the issues of persons with disabilities that are observed in our operations. It can as well include advocating, for example, with the government or through judicial interventions or otherwise, on issues observed and based on rights and through concluding observations and general comments, and as well supporting the work of the special rapporteurs on persons with disabilities. Just sharing some of the issues that have been highlighted include, for example, the improvement of living conditions in collective centers and in urban and open accommodation, both when those are facilitated by UNHCR, but as well by the states. As well, advocating for the enforcement of accessibility standards in premises where migration procedures take place. The institutionalization in these regards is really important during this period, that persons with disabilities that are in detention centers or in other institutions look either for alternative responses, or that at least that there is a strong follow-up. We've seen in the news and the data that we are receiving, the additional danger that persons with disabilities face there. And just to give an example, in some of the contexts where UNHCR operates, refugees with psychosocial disabilities may be forced to stay longer periods in psychiatric hospitals because there's a lack or a considered lack of accommodation alternatives. And finally, access to national support schemes as well. So access to disability allowances that are provided by the government. And just the next slide, I'm cautious of time. I can't see but I guess I'm going to be.
You still have 5 minutes.
5 minutes, okay, thank you. I can't see the chat box. Thank you, Jamie. So sharing those issues does not happen only through formal mechanisms of human rights, and it's not only UNHCR sharing those issues, but UNHCR as well facilitates the participation of organizations of persons with disabilities or refugees with disabilities themselves into political and other and both UN but well state-driven initiatives. For example, in the slide there is a picture of the High Commissioner's Dialogue on Protection Challenges that was held in 2017. And it was part of the development of the Global Compact on Refugees that I mentioned before, where strong commitments were shared around persons with disabilities as well. In these regards, and going to the next slide, please, I would like to mention that the Global Compact on Refugees was followed by the Global Refugee Forum that took place in December in 2019. This forum provided an opportunity to leverage existing mechanisms and develop new approaches to promote the rights of persons living in displacement, and by strengthening partnerships and as well supporting and providing mutual support among states. During this process and in collaboration with the International Disability Alliance, UNHCR disseminated a guidance for pledges on the rights of refugees with disabilities. And well, it was disseminated among state members, but as well civil society organizations, including NGOs and UN organizations. These pledges included examples of mainstreaming rights of persons with disabilities, but as well having disability-specific commitments, and opening the floor as well for pledges from organizations of persons with disabilities. It has to be highlighted that the number, while 14 pledges can be very interesting, it is true that there were beyond 1,200 pledges, and only 14 pledges had substantial commitments on rights of persons with disabilities. From those, 6 were specific to persons with disabilities. Some of them were, for example, provided by state members, in particular with additional support or commitment for governmental policy and programming on rights of persons with disabilities, but as well dedicated efforts at national level. And for example, Disabled Refugees Welcome pledged for the facilitation of integration process of refugees with disabilities in Sweden. And I believe that this webinar is part of these same commitments. I would like to take the opportunity to highlight urgent gaps in the pledges that we have identified. While I list before that identification and disaggregation of data was key to provide or to give visibility to refugees with disabilities, and is included in all the policies I mentioned, we received only one pledge from one government on improving this capacity. And as well, there was no pledges at all regarding the establishment of reception and transit areas that are sensitive or accessible for persons with disabilities. This is going to be probably an area of further advocacy and work for the next refugee forum. And just, I wanted to close with some statements shared by refugees with disabilities in consultations. And you, please, if we can see the next slide. Which I will not read them all, and for those who want to have full access can share access when the slides are circulated. But just reading one, our capacity is so big, but they don't know about that. This is a woman with a disability in Iraq. What is interesting to see is that something that is a common trend in consultation with refugees with disabilities is that they mention their capacity and how they could contribute as persons where they are going to be moving, but how this is very frequently not considered. And just final promise is slide, the next slide, please. Those are some open questions that I would like to share and that usually are shared when we discuss with organizations of persons with disabilities at national level or regional or international level on how organizations of persons with disabilities can provide assistance to persons with disabilities who are displaced, and how we can collaborate as well together. I will not read them to save time, but those are as well available. And just to say as well that the collection of slides has all the resources that I shared, which is the next slide, if we can see briefly, and that I'm open to receive questions as well. Thank you so much.
Thank you very much, Ricardo. That was very interesting, durable solutions. Yes, that's what we need. And you paint a picture where there's so much more to be done. DRW was honored to go to the Global Forum and be a good example and made a pledge. But we realize that the international work and the work within the different countries is still so much to do. And from there, we go on to Gianpiero Grifo from DPI. Please, you have the floor.
Good morning to all. I hope you are safe and protect in this period of coronavirus. My presentation try to explain more about the process that produce disability for migrants, and at the same time to speaking about some tools that are available now. In this process, we need to start for a very important issue. In the Declaration, Human Rights Declaration of 48, there are a limit of the person to go to moving over part of the world, because I recognize that the person can go in free movement, freedom of movement and residence bordered on each state, but the consideration that the person with disability or the refugee in general or migrant can go out for any country are not recognized. This produces really a first problem. Disabling situation are related about the recognition of the condition of person with disability and the status of person with disability migrant that are only if receive some recognition on asylum seeker or refugee. This means that this process excludes so much people, and the people not receive the appropriate support. On the point of view of the action, in the activity that we are developing, the convention are the main protection in relation of the person with disability, and include the migrant too. As you know, the definition of the disability is the interaction between person with impairment and attitudinal environmental barrier that hinder the full and effective participation in society on equal basis with the others. This means that person that coming from outside that have a disability are practically limited in participation exactly because the society not recognize the same status of citizen of the state. This means these persons are disabling too. And that is a concept very important. If you calculate, this is the data on 2018 from the International Organization of Migrants. In the world existed 244 million of the person in migrant. This means the 3.3% of the world population. Every year, there are a movement of about 40 million, some more, some year more, some year less. And the number of refugees are considered practically 22 million. If we calculate the 15% of the world population living with a disability condition, like say the WHO, there are 36 million of migrants with disability on 244 million of migrants. There are 6 million on the 40 million of person migrant per year, and there are 3.3 million of person with disability in the 22 million of refugees each year. This means that there is a high population, and as said before Ricardo, there are different articles that protect this kind of the person from the violation of human rights. The common condition of the migrant are related to an aptitude that produce a social and cultural stigma, discrimination or lack of equal opportunity, social exclusion. In this definition, I speak about the syndrome of oi barbaroi. In the old Greece, there are two kinds of strangers. There are the xenos, they are recognized like tourists, like visitor, and so on. And there are the strangers that are considered dangerous for the population. And this person, because these persons are considered dangerous because touch the identity of the old cities, and at the same time intervene to produce a change in the society. If you're thinking about the comparison of the treatment of person with disability and treatment of migrant, you consider exactly that this person are considered out of society, in the sense that to be checked, to be recognized, need to be checked. Second point, are considered this person a person that produce some dangers of on the condition of society. And in this sense, they need to rehabilitate before to be included in society. Third, there are a different consideration of the differences that that person have, like all person, and this produce another stigma by the color of the skin, by the cultural, by the language, and so on. And in this sense, this comparison produces exactly that the person don't have the same right as another person. And space frequently are segregating special places, need to be classified, because are excluded. The address policy must be inclusive, but are not yet recognized by the society. The migrant with disability, when they start from the country to arriving in the country of destination, have a really great challenge. Lack of accessibility, lack of support, terrible weather condition. If you think, for example, in Italy, one of the problems is the travel on the sea. In this sense, the migrant receive some terrible shock, terrible trauma, and that produces psychological consequences, mental disorder, and so on. The majority of the person migrant with disability are this kind of the condition. In this direction, we don't have so much data and information on that. The research, as a speaker, Ricardo, need to be developed with appropriate collection data. But frequently, this collection data, the Washington Group answer, are not utilized in the camp, in the action of refugee, and so on. What's happened a person with disability when are migrant and arriving in one country? The public and private organization no have knowledge about what kind of the respect of human rights need to be put in place. The competence of the staff is very low and frequently not have training on this issue. The hospitality is inadequate for various reasons, because there are no appropriate rescue, no appropriate assessment, fixed accommodation is not accessible, lack of attention of the specific need, like dietary needs or particular support. Even in the support health services, frequently have a strong time that are recognized some form of health support. As evident, other issues are related about the recognition of the status. In some countries, the recognition of the asylum process are very, very low. In this sense, it's evident that receive different treatment and benefit in a EU country is an ordinary condition. In the sense, each country have the different approach, and each country have the different action on the legislation, on the welfare action, and so on. And that is collecting with the health service, social protection, education, employment, housing, and so on. Other issues are related that the International Convention of Protection of the Right of the Migrant Worker and members of their family are not ratified in a EU country. In all Council of Europe, only the Albania have ratified this situation, and this produces a less of the protection on the basis of human rights. We, in a project that we are involved, I explain after, we check what kind of the hospitality are offered, and who is the responsible hospitality. And we discovered that in the Austria is the Caritas. In Italy is public authority that delegate NGO, Caritas, a system of protection in the municipality. In Greece is a public authority NGO. In Finland, at the United Nations HCR and the public authority. If you're thinking about that you have to understand as the homogenization of the support are complicated. If you're thinking about the activity to do, even the innovation are not so much developed. I speak some activity that we developed in some country that are in condition to upset the migrant and the migrant with disability. We, for example, collecting data with the emancipatory research in Gaza, where is emergency a condition all day. And this emancipatory research involves persons with disability to collect information and data on their condition, like say the Article 31 of the convention. This means that the person beginning to be a researcher on their condition and understanding what kind of the living condition they live related to barrier, obstacle, and discrimination, and propose some different activity in different things. We are developing this possibility in India, in Palestine, in Liberia, in other countries, and I think this is very useful for understanding the situation. The second issue are related about the activity of peer counselor. Peer counselor are persons with disability that help a person with disability to overcoming the limitation to understanding their living to developing a specific action in this field. In Turin, in Italy, we check the best project that we developing is the Prisma project. Born in 2007, are developing with a very good action. First, make in the network the authority, public authority, in this case, the municipality and the region, involve organization of society related to migrant and related to person with disability, and develop some form to protecting the person with disability in all area. And this means housing, this means employment, education, and so on. And in this kind of activity are introduced a staff that include the peer counselor. In this sense, the person can asking to have the support of this network, the person migrant with disability, and with the different activity, the personalized projects are developed and are utilize all the resources in public and private sector to support the right of this person. In this sense, I think it's very important to stress that in the area of the right of person with disability migrant, they are very, very complicated issue, because for not be recognized immediately a human person, but for waiting to be recognized asylum seeker or refugee, there are no attention in this period that this person are segregated in particular places and not receive the appropriate support. I make another example that we are understanding. For example, the female sexual mutilation are not considered a condition of disability. In Italy, for example, exists 60,000 of women that receive this treatment, but this no protect this person, because you know, if you use the definition of the convention, we understand that are not this condition are produced for a stigma, are produced for physical limitation for one of the main important human right of person is the sexuality and the pleasure. The Global Compact of Refugee, approved in 2018, is a very important issue because permit to have a high level of attention for migrants with disability. And recently, the young team group are developing a guideline on the activity of the emergency that is exactly the area that we're speaking about, migrant, that receive an attention particularly to participation, to inclusion, to be part of the society. Because speaking about the program, speaking about the responsibility, speaking of the reception and admission, speaking of the job and livelihood, the health, the women and girl, the children, adolescent, the food security, the support for country and involvement of voluntary repatriation and follow-up of the poor. It's evident that this area of the activity is an area that are less attention of the government, less attention of the people that work in this area, less attention in the same organization of migrants.
Can you finish in 1 minute, Gianpietro?
Yes, I am 1 minute, I finish. Yes. In this sense, if you look at the final observation for the European Union, based on the report, the Union to apply the convention, stress the importance that the European Union intervene in this area. Recently, the Commissioner Elena Deli say that a specific attention are on the area of the migrant with disability on different projects that the European Union has developed. Finally, I want to stress about some tools that are produced from the AMID project. AMID is a project developed by EASPD with the involved 4 countries. My organization are involved for Italy, and are addressed to support an efficient management of reception and integration of asylum seekers and migrants with disability in the European Union. The AMID project are developing 4 tools. The main important tools is need assessment tools. Is a particular database can be utilized for all, can collect information on the basis of the Washington answer group, Washington group answer, on the condition of person with disability. Lack of data is one of the problems, and these tools can permit to collect by the personal staff that work in this field, or sometimes by the same person with disability migrant, the possibility to have information. There are a guidance model and workshop session. There are a target meeting, open manuals, and finally there are research of 4 areas of the 4 countries on the field of working the condition of person with disability. In Italy, we produced the first book on this issue. It's evident that we're speaking about social inclusion. In our point of view, these persons are not object of intervention, but they are subject of intervention. This means we need to develop an organization of this migrant. It's very complicated because the language, the different organization of the community, the possibility to are affected by the stigma by the same community pose a very complicated challenge to arrive at to have that. But I think this is a very important issue to have the voice direct in an organization of migrants with disability can speak on behalf of their right and their needs. In this sense,
okay, we're going to have to stop. We're going to have to stop you there, Gianpietro.
That is the final definition.
Thank you very much. You have a lot to say and very good work. We appreciate that a lot. I hope we get back to it with the questions. But I need to cut you short to let in Anne-Sophie.
Hi, Jamie. I'm here.
Okay,
Good afternoon,
perfect.
everyone.
I'll let you
Yes,
present yourself and get on with your presentation.
perfect. Thank you very much, Jamie. And first of all, happy European Independent Living Day.
Thank you.
Normally, we're walking through the streets of Brussels, but unfortunately, this year it's a bit different. Let's hope that next year we can do again with this wonderful tradition. I'm Anne-Sophie of the European Disability Forum. And so first of all, thank you to Jamie and the colleagues of Disability Refugees. Welcome for inviting EDF, the European Disability Forum, to this interesting webinar. Today, my content of my presentation actually goes much in line of what we've already heard from Ricardo and from Giampiero, which you can see on the next slide. Anne-Marie, if you don't mind. Yes. I first of all would like to just provide to you the recommendations of the UN Expert Committee on the Rights of People with Disabilities on the situation of refugees with disabilities. I think it's interesting to start with this. And then I will go a little bit into presenting the work that EDF has done together with its members and some of our findings on the situation of refugees with disabilities in Europe. And I will conclude with some of our policy demands towards the EU leaders. So on the next slide, I just have a very brief overview of the European Disability Forum, because I know many people are joining us that maybe don't know us. So we're the European umbrella organization of persons with disabilities. We have both member organizations that are organizations of people with disabilities at the national level, but also at the European Federation, such as ENIL, the European Network of Independent Living. And so we represent a diversity of people with disabilities, and we have, since 2015, a working group specifically looking at the issue of refugees and migrants with disabilities. And so if we move to the next slide, I've highlighted here, so the recommendations that the UN Committee on the Rights of Persons with Disabilities has made, more generally on situations of emergency and risk, but also looking specifically at refugees with disabilities. Because as you know, the European Union itself and all of its member states have ratified this important International Human Rights Convention on the rights of people with disabilities. And they've made many recommendations to the European countries and to the European Union itself, as Giampiero was already mentioning, on how to ensure that refugees and migrants with disabilities are also not forgotten. So really these, I mean the CRPD of course in general, but also these recommendations from the UN for us are like the backbones of our work and of our policy demands. So this is why I just want to go through them. And to tell you that the UN committee has said, as Ricardo was already mentioning, that the CRPD actually applies to all persons with disabilities. So also to refugees, asylum seekers, and migrants. It's regardless of their legal status or of their nationality, which is really important to stress. That any policies that governments take on emergency plans and protocols, that they should be inclusive and accessible to people with disabilities. And that of course, people with disabilities should be mainstreamed in all migration and refugee policies, which will be very important recommendation to follow, as the European Union and the Commission more specifically will actually be reviewing its migration package, I think this year already. I think the plans will already start this year. On the next slide, you can see the other recommendations that the committee has made. It has said that, of course, in developing all these policy measures, we should have the participation of people with disabilities themselves and their organizations. These policy measures should look at the safety of children, and they should also monitor the situation in refugee camps to ensure that there's an adequate standard of living. And the committee also recommended to many countries that the administrative detention of persons with disabilities in migration and asylum seeking context is not consistent with the CRPD. So just to give you an overview of these recommendations, as I think it might help shape the debate maybe afterwards. On the next slide, I have included, yes, on the next slide I have included many links to the work that EDF has been doing since 2015. So I really invite you to have a closer look afterwards. I won't be able to go into everything into detail, but just to tell you that, I mean, since the refugee crisis started, we've been having many internal debates at board meetings within EDF with our members. We've also started working really closely together with other organizations such as Human Rights Watch, also the European Economic and Social Committee, and also with the predecessor of Ricardo, with Kirsten Lange from UNHCR. And so now we're happy that we have Ricardo on board to ensure that disability is included within the refugee work of the UN. So we've been working with a variety of partners besides our members, of course, and we've really tried to influence both the European Commission and the European Parliament. We've met, for example, twice with the former European Commissioner Stylianidis on this issue. We've already met with the current commissioner who's responsible also for migration with Chinas. Some of the other work we have done, which is on the next slide, is together with the European Economic and Social Committee. In 2016, we were able to go to Greece and to visit some of the refugee camps and the reception centers. So really to see there the difficult situations that refugees with disabilities are facing. There has been a report written about it that I can invite you to read. And then there was also an event at the Conference of State Parties in 2017 to raise awareness, of course, of the issue of refugees with disabilities, and also to influence the global compact on refugees and on migration, as we already talked about also. So this is a bit of a snapshot of the work EDF has done. And the last thing we have done this year actually is we've produced a toolkit together with our members and also together with Jamie. Thank you, Jamie, again for your wonderful inputs into this toolkit. The toolkit is actually looking at good practices of our members and members of our members, so of organizational people with disabilities from all over Europe and outside, actually, looking at how they are including the voices and the perspectives of refugees with disabilities within their work, because we realize that more of organizational people with disabilities are starting to work on the issue, and we wanted to collect all these ideas on how to do this properly. The toolkit also gives some legal background, so it might be interesting if you want to read about the main legal documents at the EU level and at the international level on refugees with disabilities. And it also provides some recommendation to policymakers. So you can have a look. The Disability Refugee Welcome Project is in the toolkit. There's also the project of our Greek member, NCDP, together with UNHCR in Greece, where they have actually trained more than 500 professionals on how to ensure that the rights of refugees with disabilities are included within their services. So yeah, just to invite you to have a look. And then on the next slide, yes, I'm actually gonna repeat already what Ricardo and Jopere unfortunately have confirmed, that the situation in Europe is still very troublesome for refugees with disabilities. I can tell you that EU legislation actually obliges the member states to identify people with disabilities in the reception and detention centers. But unfortunately, there's still, to our awareness, a lack of formal procedures. So many refugees with disabilities, for sure the ones with invisible disabilities, remain unidentified, or the identification happens on a very ad hoc basis, informal basis. So the results of that, which is on the next slide, is, as was already said by the previous speakers, that refugees with disabilities within the camps, within the detention centers are identified, so they don't receive the necessary support. We've heard stories of people in wheelchairs not being able to shower, to use the bathrooms, people with intellectual disabilities not receiving information easy to read when it comes to their asylum seeking procedure. Of course, many deaf refugees having difficulties in communication. Many of our members at the national level have helped out refugees with disabilities, so that is where the work also started. Also, when refugees actually move to live in society, when they decide to stay in one country, they face difficulties to send their children to children with disabilities, for example, to mainstream schools, or to find accessible housing. So in some countries, refugees with disabilities were moved into institutions. And unfortunately, we've also heard stories from many women and children with disabilities being subject to violence, to abuse, to exploitation. So really a difficult situation. Of course, as you can imagine, with the COVID-19 pandemic, it has only been aggravated. I know that UNHCR has done some research, also some other organizations saying that really in the refugee camps and in the detention centers, all the guidelines that we're supposed to follow to keep 1.5 meters of distance, to wash your hands, that these things are really unrealistic in these kind of contexts. So, but maybe we can talk about this later, and it would be good to hear from the participants if they have more information on this. And so out of all the work we have done with the UN committee and also the work we've done with our members and our partners, I want to conclude with some of our main demands. So EDF has been systematically demanding for a human rights approach to the refugee crisis for all refugees, not only for refugees with disabilities, but for everyone. We've asked the EU at several occasions that migration and refugee policy will be inclusive of people with disabilities. So let's hope that this year, with review of the migration package at the EU level, we will have a chance. That all EU funding includes as a priority that we have support, accessible information and communication to persons with disabilities and their families. And then on the next slide, yes, thanks. That, of course, the rights of people with disabilities is mainstreamed in all activities, programs, and services that are provided to refugees without disabilities, and that we have accessibility here, reasonable accommodation, that any programs that are developed, that people with disabilities and their organizations are consultants, and that we continue sharing information and good practices between DPOs and humanitarian actors. So this is a great opportunity already today, having UNHCR on board of this webinar. And as we already discussed also, another recommendation is that training continues to be happening to refugees with disabilities themselves, to their organizations, and to all staff and professionals involved in this issue. So these are some of the recommendations EDF has made and that we will continue to make. And so I'm happy to discuss further in the next hour. Thank you, Jamie. This is it from me.
Okay, thank you very much for this, Anne-Sophie. It's very interesting to have you share that with us. The human rights approach is one of our recommendations as well. There's many things. So now we'll go back to the results of DRW. Next slide, which and then talk a few minutes on this before we have a discussion. So some of the results in that, I'll talk with whom has DRW been in contact with, what kind of type of needs have we seen, problem areas, and some recommendations. Next slide. So we've been in contact as of April, we've had 93 people that we've had an in-depth contact with. We've had contact with more, but 93 people that we're working with. Of these, women are 20, men 70, and others 3. This reflects the migration flow in the 2015 to 2017, that there were more men than women at the time. From which countries are they coming? The people that we're meeting are coming either from the Middle East or the African or some African countries. In the Middle East, it's mostly Syrian, but also Afghanistan, a few people from Palestine, a few people from Iran, different countries in the Middle East. And then in African countries, mostly Eritrea and Ethiopia, where Sweden has large populations of from both these two countries from a long time. And with Julius from Cameroon. We use it, when you read our work, we talk about norm breaking functionality. We try to introduce a new concept, and rather than talking about disability, talking about the power structure and the norm that we need to break if we think we're going to actually have disabled people included in society one day. The majority, though, of the disabilities or norm-breaking functionality are physical disabilities. So we have met people with seeing impairment and hearing impairment, psychosocial, PTSD, etc. Next slide. So when we do the interview, 67 people have had a more in-depth interview. They'll have their stories, they'll tell their stories. They have a different variance in the time that they've been in the country and their establishment process. The problems that are raised are living arrangements, accessible living arrangements, employment, care, training, transport. When it comes to living arrangements, most people have gotten a roof over their head during the migration, first with the contact with the migration office, and then with the establishment process, which is 2 years, the establishment period. But when that period's done, the municipalities, not all luckily, but some are saying, now you have to move and find some place to live. And that's not so easy. But those who actually have the living arrangements, many of them are complaining it's not accessible. We have one person, a mother of 2 children. The apartment is fine, except that the kitchen's not accessible. The mother's a wheelchair user, and it makes it very difficult for her to make the food for the kids. Another woman who's the apartment 1 flight up, she has 2 small children. She can walk, but it's difficult after polio, we usually say injury in Swedish. I'm not sure what you say in English, actually. And so the leg's getting weaker, and she's suffering from this because she's having to carry the groceries up to this apartment, which is 1 flight up, which we can understand why this is happening, why people aren't taking accessibility into consideration. Access to employment, but then, which is, okay, that's difficult even when it comes to the mainstream disability movement in Sweden. It's hard for disabled people to get into the market, though it's better than some countries. It's still not living up to the main population. Access to care, meaning medical care, being able to see a doctor. When you're in the asylum process, you can only go if it's considered a very urgent matter. So we met one lady who was finding that her sight was getting poorer and poorer, and she wasn't getting access to a doctor. So through a nurse who was a volunteer, we were able to help this person get in contact with the Red Cross and eventually a doctor. So we're seeing that working as an NGO is important. Unfortunately, they're needed to help to get this, to push the system on. Training for employment, transport. A lot of the people in the beginning, you don't get access to the special transport. So if you're a wheelchair user, you're not being able to come to the meetings that you need to come to, which is complicating the system, the process. Accessible recreation, cultural leave, accessible civil society. But we'll go on to the next slide. I'll try to be a bit shorter so we'll have time for discussion. When it comes to problems, worsening of health conditions, the Swedish Health Institute actually did a report in June and came out with the result that the migrants or the refugees that were coming into the country, if they came with good health, by the 3 years into the country, their health was worsening. And that's what we see as well. I gave you stories about people living in accessible, and which added to their health condition worsening, but also not knowing if you're going to be able to keep your house is a stress. So this is stressing people, leading to poor psychological health. But other things that are isolation. If you're living in an inaccessible apartment, women are saying, oh, I only wash clothes every 2 weeks because it's just too hard for me to get to the washroom. Or I can't go out and shop very often because it's just too hard to go down all the stairs and try to get to the shop. So people are ended up being inside their houses before the COVID-19. Now we're all inside our houses, but before that, they're being isolated, and this adds to poor psychological health. We were saying that quick access to services. There are services in Sweden, but there's no quick access. So for example, getting access to the special transport, if you're a wheelchair user and need that. We're saying that one person, girl who came out, doesn't matter where she came from, but anyway, it took 9 months before she was able to get the medical certificate and actually access to the special transport. So that was 9 months of the two-year period that was already spent when you're supposed to be going through your establishment period. So she lost 9 months of that time, trying just to get the permit to be able to get to the Swedish courses with the transport. Referencing people referencing to other actors. By this we mean, for example, we had a person who was blind, who had gone through the migration office, who had gone through the establishment period, who was living in the community. So already 3 different levels of authorities, and was still sitting in a Swedish course next to people who were seeing, but she herself was blind, not accessing Braille and ways to be able to read herself. It wasn't until finally somebody told her to see a doctor that could tell her to go to the site central, where they introduced her to the different technical equipment that you could access to be able to learn the language. So coordination between actors, this story is one of that. If this person had gotten help already in the migration process to realize when you get to the establishment process, you're going to need access to this kind of equipment, it would make the life so much easier. But there's not this communication between the different authorities as there should be. Another problem that we encountered was a couple of women that we have the right for them to keep their children. When they ask for support to be able to take care of their children, the authorities have said they want to take the child. They turn to us, of course, very hysterical. What am I going to do? They're going to take my baby. One baby was just born that day when they told this poor lady this. And we said, no, they're not going to take that baby. We will help you and help to support you, because you have the right to keep your child and to ask for support. So there's different problems. The way people are being treated isn't the way they probably should be treated, or definitely not the way they should be treated. Next slide. So recommendations, some of the recommendations we heard. We talk about different perspectives at the starting point. One is a human rights perspective that you talked about, Anne-Sophie, the disability perspective, I think it was Giampiero who talked about, but also the health perspective and the intersectoral perspective. We feel that you need all of these four perspectives from the very, very beginning, working with all of us, with the disability issue in general, but especially with the refugees, in order to be able to have a good outcome. Increasing knowledge on culture and context. And this is for both sides. The immigrants who come to Sweden need to learn how the Swedish system works. What do I have right to? What do I not have the right to? But for example, we met one man, and he has his wife who is a wheelchair user with a severe disability needing personal assistance. But whenever he calls us, we can't talk to the wife because he says, I'm the one who decides. But we said, but in Sweden, it's very important that the person who needs the support, if the person can speak, it's good that we can talk to this person. When we finally were able to talk to the lady, she speaks pretty good Swedish and was very happy to talk with us and share her stories. So it's learning the culture from the two sides. Development of migration networks for diversity. I know that Giampiero has this somewhere in some slides that I've seen. We've seen that it's very important for us to work with all kinds of actors, whether it's the authorities or the other DPOs or the other civil society, the Red Cross, Caritas, or working with the refugee organizations where they have lawyers to help with the legalities around the migration process. So all the working with the unemployment office, all the different actors are so important, again, to make the chain and the integration to be as successful as possible. And last but not least, I talk about health promotion again, that the people need to learn how important it is to stay in good health, and also how they can do that, but also the right to rehabilitation, which we're seeing again is not happening with many of the people that we meet. And I think that was my last slide. Thank you very much for allowing me to present DRW. Thank you to all the speakers for all the different important things we've heard today. And with that, we open questions and discussions. Unfortunately, I've done something where I can't see hands raised, so this I have to ask you, Ines, to help me here.
Yeah, thank you, Jamie. So we have had several questions coming in during the webinar while people were presenting. So I will start with those and then get to those who raised their hands. So the first question is from Nadia, and it's a question for Ricardo. The question is whether you are making the link with Article 32 of the Convention on the Rights of Persons with Disabilities on Development Cooperation, and how are disabled refugees included in your work, not only as beneficiaries, but also as potential experts and stakeholders locally and on international level? And the second part of the question is also for Ricardo, is about the link. What kind of links are you making with the work on sustainable development goals, especially goal 11? Is there a common program to ensure disabled people's rights within your department and the UN department working on SDGs? So let's start with that question. Ricardo, yeah, go ahead, please.
Thank you, Nadia, for the question. answering part by part, well, regarding Article 32, and I didn't mention neither Article 11, which luckily Anne-Sophie expanded more. Sincerely, it was in interest of time. It is true that it is really relevant, and as I mentioned, well, the core of the Global Compact on refugees is international cooperation, right? What is calling at that particular political effort is at strengthening cooperation between member states, so that host countries that usually are absorbing more, or those countries that are absorbing most of the migration movements, are supported by other governments. It's a very good point. And in a very comprehensive, let's say, article, the study should have been absolutely mentioned. Regarding perhaps linking with the SDGs as well, very relevant. Of course, making cities and other human settlements inclusive and participatory is really important. What I am not aware, and I was trying to look for information, at least in my department or in my division, there is no dedicated program as such or for strengthening SDGs. However, our programs are contributing to the SDGs. So it could be looked the other way around, where it can be found information, and that I didn't have time to do while because I wanted to listen to others as well, but I can check whether within the last UN flagship report on persons with disabilities, which is publicly available online, there are contributions for that particular goal. So there it can be different, the different rights and how they are reflecting the rights of persons with disabilities, or the different goals and how they are reflecting the rights of persons with disabilities is included. And I know that UNHCR contributed as well with information. So as I said, just summarizing, there's no dedicated program, but there's collaboration into monitoring mechanisms. And as well now with the UN Disability Inclusion Strategy, there is a network of focal points across UN organizations and sharing of information and good practices. So this is as well something where we are hoping to learn more from what other countries and other UN programs are doing, or UN agencies, and contribute, look for cross collaboration. There are other programs such as the UNPRPD, etc., but that would be taking more time. Regarding participation, absolutely, the participation of persons with disabilities as technical experts. I think the best example, and Giampiero has mentioned this, at least at the international level, has been in the development of the Interagency Standing Committee guidelines on inclusion of persons with disabilities. This is now the overarching guidance of reference for the UN system, at least as regards to inclusion of persons with disabilities. And the International Disability Alliance, and through this network, all hundreds of members were involved in the development of the guidelines, but as well leading the development of the guideline through consultations. And the program, the capacity building mechanism called Bridge as well, so Bridge SDGs CRPDs, has a dedicated module on Article 11, which is as well a way in which persons with disabilities and their organizations are being empowered to become not only advocates, but as well technical experts that can be involved. And I have engaged and witnessed as well directly how some of the alumni to that program have been then involved in providing professional technical support in their countries, but as well to international organizations. UNHCR, and with this I would like to close, has now is discussing with the International Disability Alliance the development of a memorandum of understanding, and hopefully through that memorandum of understanding and using the UN Disability Inclusion Strategy, which is going to as well enforce or engage further our country teams. we would like to make connections within national DPOs or between national DPOs and our country teams in different offices or country offices, and try to establish those technical support exchanges, of course, trying to professionalize those collaborations. I think, just to close for sure with this, I think there should be a very clear distinction when we're talking about consultation and we are talking about opinions and we are talking about experiences of persons with disabilities, and when we are talking about technical collaboration, which should be professionally recognized and as such reimbursed, right, or recognized financially. And this is, at least as an advocate individually, I have been stressing that need as well, that sometimes there are consultants used and recognized financially, while persons with disabilities are consulted and not recognized financially. Why, when the outcome is similar, it should be recognized on an equal basis. Thank you.
Thank you, Ricardo. Actually, there was a proposal similar to what you were saying of a permanent dialogue between UNHCR and national organizations of disabled people to guarantee human rights of refugees with disabilities from Spain. So it would be good that once this materializes, that somehow the information is passed down to organizations at the local and national level, so that if they are in contact with disabled refugees, they can join these collaborations platforms or whatever it is. I will continue. We have quite a few other questions. Maybe this one for Gianpiero. There is a question from Diana, whether you would recommend using the Washington group questions to collect information about disabled refugees, and whether there is any other data collection mechanism you would recommend. And maybe linked to that, is there information about disabled refugees all over Europe?
Okay. The question about the check the person with disability migrant in the actual system of the protection. This means when a person arriving in a country that receives some first assessment. But frequently this assessment is an assessment that are only the first level of the health condition of the person. Frequently in this first assessment are not the capacity to check for recent mental disorder or particular trauma stress, and this person not receive appropriate support for a long time. The project AMID have discussed about that, and understanding that the first possibility to enlarge the level of attention of person with disability is use the Washington group answer. What we have do, we have put on the availability of the staff that work in the field of the migrant a tools named the NAT, Need Assessment Tools, that permit to collect information based on the Washington group answer. This means the Washington group answer are useful for all persons, because are the question very easy to understand what kind of limit the person feel and live in their life for mobility, for sensorial, for intellectual, and so on condition. This collection data is a data free, the person can use in all parts of the Europe, is a database that collects information taking account the different cultural approach of the migrant, and at the same time to include some issue can be useful to understand exactly what is the condition of this migrant. Is that tools can be interrogate, there are a particular manual I provide to organizer, to ENIL, all information on this. But the question is exactly that. If we remain on the base of the medical approach on the assessment, it's sure that migrant not receive the appropriate assessment. Because taking account, if at the beginning, the arrival of person is only a checking, general checking that says something about the health condition. But to provide appropriate support, frequently need to be a very detailed action related to the person. And that is not possible frequently in the provisional place of guest this person. And to benefit of the different activity that the legislation recognizes to persons with disability, need to have a formal recognition. They have not only refugee, but recognition of disability. In Italy, this is possible, but not happen immediately. About the new form to collect information, the Article 32 of the Convention speaking about what is the kind of barrier, obstacle, and discrimination that hinder the enjoyment of the right of person with disability. Actually, the majority of the resource when is available on the data and statistic are not based on this approach. For that, we are developing an emancipatory research that involve persons with disability. They are subject, in this case, as a researcher that with the support of university, appropriate methodology, scientific methodology, receive training to beginning to have a knowledge about the research, and after use different form of the collection data. This means interview, this means focus group, this means questionnaire, and so on, that collected information. And finally, this solution not offer quantitative data, but offer qualitative data, can be very useful to understanding the condition of person with disability. For example, propose some support in the legislation to prepare an appropriate alternative report for the convention, to introduce some idea about what kind of barrier this person living and what kind of discrimination are subject. In this sense, both tools, this means Washington Group answer and emancipatory research, permit to have a broad vision about the condition of person with disability and possibility to act at different levels. I want to stress only one thing before Ricardo. I think the question related to person with disability is that we need to transfer at international level all the competence of the advocacy to person with disability organization of person with disability. This means when we say nothing about us without us, is evident. We are the protagonists and we need to be participate to represent person with disability. That is exactly what I think in all parts of the country. For person, migrant is the same, arriving to have an advocacy capacity of the organization that permit to person with disability, the organization, to be citizen, a protagonist and representative of their right and of their needs.
Thank you very much, Giampiero. Let's take a question for Anne-Sophie now. And that is, Anne-Sophie, are there any specific good practices from EU member states in terms of procedures for asylum seekers with disabilities? And maybe to add to that, there was a question by somebody who is an asylum seeker and in one of the EU member states, I assume, and he or she is having trouble accessing support. And to get that support, they have to use a lawyer, which costs money. So what would you advise maybe for people like that? What is the best advice, let's say, we could give them now? Who to turn to? Is it Can disability organizations provide that kind of support at all, or would there be another instance at a national level where people like that can turn to?
Yeah, thank you, Ines. On the first question, we do not have a specific good practice yet on good practices with regarding to asylum seeking procedures. I know that the Italian Down Syndrome Association has developed a booklet to really welcome families of refugees with disabilities. So maybe I could have a look more specifically within this booklet to see if there's any more detailed information on this. But I'm not aware, unfortunately, of such a specific good practice. It would be really good to have one. And on the second question, I would advise a person to contact the Organization of Persons with Disabilities in the country. I don't know which country the person is in. She could do that, or the person could do that as a first start. And we could also link the person up with the equality body in the country. The equality body, these are organizations that are dealing with cases of discrimination of persons with disabilities. I know they often also work on the issue of refugees. And I know they also have often the mandate and the competence to really support the person also in legal proceedings, sometimes even going to court. So of course, lawyers are really expensive. So this can be an alternative to have like a first opinion, to have a first advice on what to do. This would be my recommendation. But I would say to that person, please don't hesitate to contact me. My email is on my last slide of my presentation, and I'm happy to see where we can direct you to. Yeah.
Thank you, Anne-Sophie. And can I just add to this, is there a report about disabled refugees and migrants in Europe, like an overview of? There's
several. There's not an overview of the situation, but there's several reports. I know that Human Rights Watch came out with a report some years ago. Of course, on the website of my organization, there's a lot of information and a lot of links. I don't know if UNHCR has drafted a report specific on Europe, but I know they have one more general looking at the refugee situation. They do regular updates. So this is what I can contribute.
Okay, thank you. Yes, go ahead.
I can say yes. No, I think the area of protection need to be explored and developed, in the sense the human rights instruments are different. This means they are the Convention of the Right of Persons with Disability, they are the Convention of the Right of the Children, they are the Convention against the discrimination for women. I think the majority of the country have ratified this convention, but it's not clear about the relationship that exists about the provision of different conventions related to migrants. This is a new challenge to developing, because after understanding how is used, the three instruments is need to check about the national legislation. For example, in Italy, the children, migrants with disability, have the right immediately to go in ordinary school. That produces that one of the problems is to convince or to inform the family that coming from a country that are not this right, the possibility to be enjoy this right and so on. In this sense, I think it is important to developing some research or some project to explore this kind of support.
Thank you. Thank you for adding that, Gianpiero. That is very useful. Let's take a question for Jamie. There was a question, Jamie, from Jim in Scotland. He is asking what chances, basically, if the countries that ratified the CRPD are not even implementing it in terms of their own citizens, how can we encourage them to recognize the rights of disabled refugees? And there is another question about how does the general society welcome disabled refugees, and whether you have done any awareness raising campaigns on that as part of your work.
Thank you. Yeah, getting the countries to recognize the UNCRPD. I mean, many have ratified it, but then the implementation, and we're quite frustrated when the country reports negative feedback and don't really do what we think they should be doing about that. We are trying to develop relationships with other actors. One recently is the Swedish Church, which is quite a large organization in Sweden, to have them to help to push us for the rights of disabled people, to raise the awareness generally. If we've had campaign, no, what we've done is we've been active in there's meetings in Sweden like this, what's called the Human Rights Days, and there's 2 or 3 days, a lot of NGOs and people can come to these meetings, and we've been to those to represent and present the work that we do on DRW, but also another project called Article 19, using it as a tool. There's something called, in the summertime, there's a great big meeting on an island of Gotland where politicians come and all different kinds of civil society, and we're there, and then we try to write articles in the newspaper. But our project is quite small and the money hasn't allowed to do any larger campaigns. It's just sending out Facebook and trying to get in touch with as many people as possible. So I agree, yes, one's frustrated with how, I mean, you seem to make 3 steps forward and 2 or 3 steps backwards. And I don't know if we're going forward or backwards anymore, but it's hard work we're doing actually, whether it's the issues of disabled people in general or the group which has a more difficult situation, the disabled refugees, migrants.
Thank you, Jamie. And I'd like to invite everyone to look at the chat box. Anne-Sophie has copy-pasted some links to useful reports. Also, we have a comment from Sylvia in Italy to please pay attention to the violence abuse suffered by women with disabilities during the long travel to Europe. And comments from some other people. There is another specific question for Ricardo, and that is whether the UNHCR is doing any programs to empower migrants with disabilities to raise their own voices and to be the experts to improve their own situation. And I will ask you another question right away, and that is about the situation now during the COVID-19 pandemic, whether you are aware of any good stories of positive action by any EU member state, specifically targeting refugees, and maybe Giampiero and Anne-Sophie can add to that.
Thank you, Emily. Regarding programs for empowerment of refugees with disabilities, not in Europe, that I am aware of. I have heard of those programs in countries in Central Africa, in Asia, but not in Europe that I am aware. Beside, and sorry, the program that Anne-Sophie mentioned, the interest that I have recently as well arrived to this role as well, as Anne-Sophie mentioned as well, that and following the work that my predecessor did, would be to formally engage in answering a question as well that was shared by Jesus, formally engage with organizations of persons with disabilities through a sustainable, let's say, collaboration through a memorandum of understanding, and supporting programs that are already existing in country or developing programs following or mirroring the work that this Bridge, for example, program has put in place to empower persons with disabilities who are as well refugees to become advocates, but as well experts that could be engaged in consultations. The experiences where I have seen this done are of incredible value, and there are only the only issue that sometimes we have seen is linking both national agendas and agendas of people living in displacement, where there are common goals, there are very shared objectives and ambitions as well, but a lack of understanding. And there is where I think UNHCR or a lack of financial support sometimes can have a role. I wanted as well to take the opportunity to mention just quickly 2 additional points on Jesus' intervention in terms of accessibility and reception centers and other reception centers. While UNHCR, I'm not aware of reports in Spain, I am aware of reports in other countries where it has been shared through the CRPD committee, the obligation of member states to follow accessibility standards that apply in their countries as well in those centers. So this is the way it has been done in other countries, but not in Spain that I am aware. And a last question as well, in terms of gender-based violence, which is, I think, very, very relevant. It was shared by Jamie, how women with disabilities are reaching less Europe. And there, I think one of the key issues is who is, or how is it possible for women with disabilities to leave situations of danger, but as well cross those situations. And where I think there is not enough evidence is on the experiences they face across the way. So very, very important point as well. I don't know if I answered the question as I got to answer several at the same time, sorry.
Thank you, Ricardo. Or maybe somebody else wants to comment. Maybe Giampiero, would you like to comment on the current situation during the pandemic? Are you aware of anything specifically?
Yes, I am in the task force that in Italy explore what kind of action need to do in the field of the second phase of the COVID-19. I want to stress 2 issues. First, we don't have the traditional vision about how it's possible to use program related to the person with disability, in the sense, the migrant with disability. There are programs for migrants, okay. The problem is mainstreaming the migrant with disability in the program of the migrant. The AMIF project, for example, in Europe, produces exactly that attention. And that is exactly in all areas of the activity that the European Union developed. This means that if a project are presented in all programs that provide support and respect human rights, it's possible, if the project is right and good, to be accepted and financed for particular situation that person with disability, in this case migrant, can be violated in human rights and have the same opportunity than others. Remembering that the convention are, the European Union have access to the convention, the 27 country members are ratified the convention. This means it's a standard in all parts of the European Union. But even in the Council of Europe, only the Liechtenstein not have ratified the convention. This means 47 countries have the same standard, and that is an issue that, in my point of view, can be favorized the mainstreaming of disability. About the situation in COVID, this is a little complicated. We don't have so much data. And data for migrants with disability, less, more. In Italy, for example, we know that a very few number of migrants are affected by the coronavirus. This means my last information is from 20 to 30. But we don't have this information because it's not true that in the Center for First Guest there are a system to check with the appropriate screening the condition of this person. In this sense, the difficulty relate way to the status recognition in different countries and the attention to protect. If you're thinking about what's happened in the residential long care in Europe, these persons are not protected. I speak about persons with disability and elderly people, but are excluded, are invisible. This means, I don't know what's happened in the migrant, but have the same treatment, are excluded, are not included. I don't know what kind of support country by country are put in place to protect with the DPE or with the other organization system, the migrant in the country.
Thank you very much, Gianpiero. Again, Anne-Sophie posted a link in the chat box for anyone who would like to have more information.
I actually have a good practice if I can share.
Yeah, go ahead.
But it's more general. I first of all want to say that EDF has, of course, with its members, have been doing a lot of efforts on the impact of the, I mean, to raise awareness on the impact of COVID-19 on the rights and the lives of people with disabilities. And we've collected all of this information and the work of our members on our website. So there's a lot of resources there actually. But some good practices are coming through in the sense that a lot of our members in Italy, Spain, and France have actually done really heavy lobbying with their governments. Because of course, as you can imagine, many people with disabilities were really, had their lives really complicated and very difficult due to the quarantine rules. And so due to the lobby efforts of our members, the governments in these countries had made some exceptions. Then I also know that in San Marino, the government has issued some guidelines to not discriminate against people with disabilities when they go into healthcare. As you might know that we've heard unfortunately from some countries that when people with disabilities were going into hospital with the virus, that they were actually not treated because of their disability and the supposedly short life expectancy that they have. And then I also can tell you that the Italian government finally announced a plan for a strategy during the recovery for people with disabilities. And this I can also share with you in the chat box if you want. So these are 3 good practices that I think are hopeful. Thank you.
Thank you, Anne-Sophie. I will also share a link to the survey that ENIL is involved in, which people can complete if they like. It's about collecting data about experiences of people with disabilities during the pandemic. And Jamie, I will hand over to you there. We've gone through the questions now, so.
Okay, good. I was just, sorry, I'm thinking of the links that you're sharing there, Anne-Sophie. I'm wondering when we turn this off, we lose the chat, I think. So it'd be good maybe if we could get an email with the different links that everybody has shared as well, and then we can include that in the materials that we send out to everybody, if that would be okay.
Yeah, I can, absolutely.
Okay, thank you very much. I guess with that, I'll say thank you to all the speakers for helping us to make this into what I think was a successful event, and thank you to all the participants who have come to listen. For me, it was a good experience. I've learned different things, and I hope everybody else has done as well. I want to close saying that it is the European Independent Living Day, and ENIL is using this day to raise awareness on. So they're calling governments to listen to the voices of disabled people, especially those that are most marginalized. And I say that we can include not only those in the institutions, but also the people, the disabled refugees. Make a commitment to closing down all institutions. We're seeing now with COVID that it's the COVID-19 with the elderly people living in these larger institutions. Those are the people that are dying in Sweden. This is terrible. If we would have closed those institutions before, that we wouldn't be having the situation, and that we should protect the rights of disabled people of all ages, and no matter what disability and from where we come. And with that, I'll close and say thank you very much. And again, happy Independent Living Day, and hope to see you again in this in the discussions, the debate, and the development within this area of disabled refugees.
Thank you, Jamie. Bye-bye, everyone.
Bye-bye, everyone.
Thank you. Bye-bye.
Thank you.
Bye-bye. Thank you, everyone, for taking part. Bye-bye.